Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, some Metro Manila hospitals now being pushed to the limit. As new COVID-19 cases continue to rise, medical authorities say several major hospitals in the region are now full because of the spike. Also, amid new COVID-19 variants and perceived complacency in following minimum health standards, local government units hope to stem the virus spread through curfews and localized lockdowns. But will these be enough? And what lies ahead for the country a year after the community quarantine? Health Secretary Francisco Duque joins us live. As the country marks the first year since it was placed on lockdown due to the pandemic, COVID-19 cases continue to rise in alarming numbers. The total confirmed cases is at 621,498 after recording 4,899 cases on Sunday. Researchers from Octa Group say that without proper intervention, the country will soon see 8,000 daily cases by the end of this month. Medical authorities are sounding the alarm since Metro Manila major hospitals are now in full capacity. Let's go straight to the source of this story. We have Health Secretary Francisco Duque. Secretary Duque, welcome to the source and thank you for your time, sir. Secretary
Hi,
Duque.
Pinky.
Okay. Yes.
Hi, Pinky. Thank you. Good day to you and your viewers in behalf of the Department of Health and the IATF.
Okay. Secretary, let me start with the numbers. COVID-19 numbers. Yesterday at almost 4,900. On Saturday, it was 5,000. That's the highest since August, 1 year into the lockdown. What would you say, Secretary, is the cause of this surge?
Well, the cause of, I would say the causes of the surge, actually a combination of factors. Number one, we've said this before, the quarantine fatigue that people are experiencing, the breach of our minimum public health protocols or standards, and to a certain degree, but not absolutely determined as of yet, the possibility of the variants contributing to the surge, and then of course the loosening up of many quarantine restrictions and also opening increasingly a large part of the economy. Mm-hmm. Which brings about increased transmission rate, increased contact rate, and increased duration of infection.
Yeah. So if you look at the cases, 5,000 Saturday, 4,900 Sunday, and 5,000 Saturday. Secretary, are you alarmed by this?
We are alarmed naturally. Because of the increases that have actually started since March 4. The significant increases began last March 4. And as you correctly pointed out, this is approaching the levels similar to our first wave during the July, August, September months. So again, we need to remind our people of the protection, the very important protection that our MPHS provides, and that there are no shortcuts here. We really need to follow. And so this is what we do. We have been meeting with the NCR mayors and also the LGUs of regions where increasing cases have been observed, and to remind them to strengthen all the interventions that they have done quite successfully in controlling their pandemics, in the earlier or in the middle of 2020, that is.
Let me ask you this, Secretary, because you did correctly also point out that the increase in numbers started sometime about March 4. In fact, if we look at the past 1 week to 10 days, I think we were averaging about 3,200 cases, if I'm not mistaken.
You are correct.
If we saw already an increase in March 4, Secretary, and then we have these variants, which I want to discuss a little later on, sir, didn't we act soon enough, knowing that it's a confluence of events, as you mentioned during the early part of our interview, fatigue, opening up of the economy, these variants. Kung March 4 po, nakikita na, or nagtala na ng pagtaas ng increase, umpisa ng pagtaas, 10 days later, did we act a little bit too late?
No, I think we have constantly reminded our NCR mayors, because this is the epicenter, that we have told them the projection of the OCTA, the Epidemiology Bureau. And so we have underscored several times the importance of the compliance, intensified compliance of the MPHS. No? But what we see today, a continuing increase in the number of cases, we'll have to wait because it will take normally about 2 to 4 weeks, no, to see the impact of the measures that have been put in place by the concerned LGUs.
So if the LGUs...
So, tingnan muna natin ito.
Opo. Secretary, I just need a follow-up on that. If you're saying that the LGUs, of course, have already been informed, and really, they're the ones on the ground, di ho ba? Did they act a little too late? I only ask that question, sir, because kung balikan po natin yung nangyari sa Pasay, that was over, 2-3 weeks ago. There was already an increase in cases there. Nandun na po yung UK variant, I think pati yung South Africa variant. And then we were really just looking at localized barangays. You know, the barangays there from, 15, naging 20, naging 60, naging 70 yung lockdown. But not the whole barangay, just certain households in barangay. Wasn't that already back then, kasi nga napaka-porous po ng NCR, a cause for concern?
Well, we have all agreed in the IETF that the LGUs must really effectively implement the localized lockdowns. And I think there has been an increasing number of barangays that are now on a strict lockdown. No? So tuloy-tuloy naman yung kanilang ginagawa. We cannot attribute the variants to the increase alone, because nothing is definitive with regard to the variants. Because if you're going to look at the statistics or the data of the Philippine Genome Center, ang malaki pa rin na or dominant variant na umiikot is still the old variant, the Hong Kong lineage of B1126. No? And then the UK variant represents only about 3% of the total whole genome sequencing done, followed, of course, by the P3, the new variant that was discovered in the Philippines, which is not yet a variant of concern. That is the percentage, I think, is about next to the dominant variant, which is the 1126. And then the UK variant is only 3%.
Yeah, okay.
And then the South African variant is 2%. So mababa pa eh.
Yeah, but would you say that would be very accurate, Secretary Duque, knowing that hindi naman po napakaraming batches ang nagagawa ng Genome Center in determining the variants? Because from last I remember, the UK variant affected about 109 cases, tapos yung pong South Africa variant about 90. But would that be accurate? Again, going back to my question, kasi hindi naman po talaga lahat nasa sampulan sa Genome Center. They just take batches, and it takes a while.
Well, as I've said, it's the surge is a result of a combination of factors. No? I'm not discounting the possibility that the variants, especially the UK variant, has been known to be responsible for 50 to 70% transmissibility, increase in transmissibility. No? But the Genome Center has very clearly established the figures na ang dominant pa rin yung Hong Kong lineage. But be that as it may, it is the increased mobility that I think is responsible for the significant increases that we have been observing over the past few weeks. No? So the increased mobility, loosening up of our restrictions, yung mga GCQ natin, actually many of the measures or restrictions have been loosened up parang as a MGCQ. No? Actually, kahit the GCQ lang, in name only. But if you look at the loosening up, yung bars, yung salons, yung mga MICE,
parang
yung
nasa
meetings,
MGCQ na.
conferences, yes.
So,
but again, this is because of the economic, consideration. This whole thing is really a balance between health and economy, but they shouldn't really be mutually exclusive. They should be done both ways, that opening up the economy safely.
Okay.
No? So we need to underscore, emphasize yung minimum public health standards plus ventilation and the code interventions, no, of contact tracing, of testing, of aggressive isolation through the Oplan Kalinga, and the treatment, no, effectiveness. And now we've seen improved clinical management of the cases, and that is why the number of deaths is not as high as it was during the first wave.
Secretary, how would you describe this? Ito ho ba surge? Ito ho ba second wave?
Well, the WHO, Dr. Abhiya Singha, has stated that this can be referred to as a surge.
Sabi niya po, hindi second wave because hindi naman po daw tayo natapos sa first wave.
Yes, hindi naman talaga ito bumaba to very, very low levels. Pero bumaba siya to a level na na-spread out yung cases so that it did not overwhelm the healthcare system beginning, I think, October, November, December, January, and until February. At ito nga lang March, nakikita na natin ang very rapid increase in admissions in our COVID referral hospitals and COVID dedicated hospitals.
Yes.
No?
Secretary,
so nag-plateau naman tayo to the point that for some time we have not seen any rise in the healthcare utilization rate of our health systems capacities.
So we need to take a very short break, but really the next topic we need to discuss is yung ho ba mga curfew, yung ho ba mga granularized lockdowns, and the hospitals, the state of hospitals. We need to talk about that after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. Secretary, let's just briefly talk about, so we have the UK variant, we have the South Africa variant, and we already have a confirmed one, Brazilian variant. And please explain in simple terms, ano ho ba talaga si P.3? Would you call that the Philippine variant or not?
No, the P3, this is the nomenclature that has been given to it by the pangolin. No? Pangolin is the phylogenetic assignment of named global outbreak lineages. That's highly technical, forgive me, no? But that is what it is. So it's P3, and so far, it's not yet a variant of concern. Why? Because there's not enough data to say that this particular variant has in fact affected the epidemiology of of the COVID-19 variant, of this particular variant, hindi malinaw kung mas mabilis ba itong kumalat or ito ba ay mas malala yung virulence o pathogenicity ng clinical process or condition, and hindi rin malinaw pa kung nakakaapekto ba ito sa effectiveness ng mga bakuna. So patuloy ang monitoring nitong particular variant na ito, and we will be we will give you updates on this, no, as regularly as possible.
To be clear, it's not a Philippine variant, Secretary, and there's still no Philippine variant.
It's not. You call it a P3. That's what the nomenclature is.
Okay. And then I want to quickly talk about Okta, Secretary. So previously, they were saying that 6,000 their projection was 6,000 cases by the end of March. That has been revised, sir, to 8,000 by the end of March. Projection po yan if we go into the same pace as we have been seeing. Do you actually see this happening, sir?
Well, anything is possible, no? If the measures are not implemented aggressively, no? That is why it is incumbent upon our local government units to really be very aggressive, to intensify all of our prevention, early detection, isolation, treatment protocols, no? So hopefully it doesn't happen. But the impact of the measures that have been put in place will be felt after 2 to 3 or even 4 weeks. So we will just have to wait and constantly remind the LGUs to ramp up their pandemic response.
Yeah.
And they already know that. I mean, they've already mastered all of this after 1 year of learning, after 1 year of actual management of the response in their respective LGUs. So it's really intensifying, ramping up, being more aggressive, more deliberate. And that's why I told some of the mayors, we have to go out there and really educate people, remind them constantly of the importance of MPHS, whatever the variants, no? UK or South African, P3, P1, it's still the MPHS. I think that is the strongest protection that we can possibly have against this surge that is happening.
Here's the thing, though, Secretary. If we are going to look into 2 to 3 weeks for the implementation of such measures being done by the LGUs, would that be a problem to the hospitals? Because pagka 2 to 3 weeks parang napakatagal na nun. If the cases continue to rise, we might have a problem in terms of utilization and capacity of the hospitals. PGH, East Avenue, San Lazaro, and Lung Center, I believe their ICUs are already in full capacity.
Well, Pinky, if you look at our current active cases, 48,500 plus, 1.6% severe and another 1.6% critical. 92% mild and about 4% asymptomatic. So the capacity is there, Pinky. And that is why we have constantly reminded through the One Hospital Command Center to really refer patients who are not in a severe and critical condition to be put in the lower level facilities for which we have ramped up the capacity. Naalala mo yung temporary treatment monitoring facilities, these are isolation for the mild, very mild condition, and then the quarantine facilities for asymptomatic positive cases. Kasi kung hindi gagawin ito, mabibilaw ka na ospital with even the mild, the moderate, the asymptomatic, and you're gonna crowd out those who really genuinely need the critical care, for this serious or severe COVID cases. So it is really a function of how well the referral system is working. And we have ramped up the capacities, you know that, no? In the period of relative quiescence, medyo napababa natin, di ba? December, January, up to the first weeks of February. In fact, November, nag-umpisa na tayong bumaba. Bumaba. And we took that time to ramp up our capacities. No? So testing, isolation, quarantine facilities through our facility quarantine Secretary Mark Villar. No? He has been putting or adding several more beds for our mild and asymptomatic cases. No? Sa QI, sa several places. No? And we've ramped it up. So this is now going to really be an effective function of our referral system through the One Hospital Command, which is led by Yusek Bonvega.
Yes, I spoke to him.
Doing a great job.
Yeah, I actually spoke to him last week, Yusek Vega, Secretary Duque, and we were asking about that. Kasi the problem is when we talk to some of the hospitals, let's say St. Luke's, Quezon City, full na po yung ICU nila as of last week. So sabi nila kung magkakaroon sila ng critical patient, they have to move. Yun naman po talaga yung problema, Secretary. Something we've learned throughout this pandemic. Kapag mild, pwede ka na talaga sa posibleng bahay or sa quarantine facility. Ano po? What we're really looking at are critical and severe cases. But even if you say that the numbers are low, at 1.6 and 1.8 critical and severe, that totals about 3.4%. Medyo malaki pa rin po yun considering the active cases are 48,000. If we do the math, that's still about 1,600 severe and critical cases. And the problem there, Secretary, as we know is, nagtatagal ho talaga sila sa mga ICU. So, I guess, let's just move on. I need to ask you very quickly, sir, are you looking into possibly stricter measures? Sabihin po natin, are you considering, recommending possibly, if the numbers continue to rise, na bumalik po tayo sa stricter quarantine?
Well, you see, the stricter quarantine measures are now in place, but only more localized, more granular. But we'll see what happens in the next few days if there's going to be really continuing increase, then that should be one of the possible recommendations that the IATF will first discuss before recommending to the President. So we will have discussions on this. That's for sure. But yung 1,600 mo, no, very quickly lang, hatiin mo pa yan sa NCR, that's only 800, no? Kasi the share of the NCR is about 47 to 50% of the total critical and severe cases, no? So we have that capacity. But kung maraming mga ibang mga pasyente pupunta sa mga ospital, ay talagang magkakaproblema tayo. So it is the effectiveness of the referral that should be maintained. Under
the One Hospital Command. Secretary, we need to take another short break. This is The Source on CNN Philippines. We'll be right back. Secretary, we have a few minutes left. I wish we had more time. 1 year into the lockdown, Secretary. Malacanang is saying we did an excellent job. Secretary Roque said that. In fact, I even asked Yusek Vega about that. He said we're doing a good job. Do you think we are doing an excellent job? Because if excellent is being used, according to Senator Ping Lacson, ang problema na doon, if government believes it, kasi if you say excellent, it's as if there's no room for improvement. How do you assess 1 year after?
Well, there is always room for improvement, Pinky, no? This is a new phenomenon, okay? So there's a lot more to learn, and we cannot be claiming as if we know so much about this, because this can be very treacherous. This virus, no? You don't know which bend it's going to turn, but we just have to prepare, and we have learned a lot of our lessons. We have done it before. We can do better, no? As we have seen, yung December, yung holiday surge na inaantay, hindi nangyari, no? Although I think the February 14 and the February 18 events, holidays might have contributed to the surge that we are seeing now, no? But the New Year, the Traslasyon, the Christmas season, we were able to keep the numbers really low and our healthcare system's capacity at low risk classification. No, so there's a lot more to be learned.
Okay.
We need to be very open to criticisms because some of these criticisms can actually help. It's not meant to be personal. It's not meant to be subjective. But I think the objective is really to help government improve its pandemic response.
Okay. So it needs improvement, of course. Secretary, I wish we had more time. So many questions still. I prepared, pero wala na pong oras. I hope sometime soon, sir, we'll have another...
Gusto ko lang pasalamatan, Pinky, very quickly, I just want to thank the LGUs, no? For really being on the job. They're responding to it as aggressively as they can. Hindi na nga sila natutulog, gabi-gabi na halos nagmi-meeting. And also the healthcare workers, no? After 1 year,
Absolutely.
we continue to acknowledge, recognize their heroism, which is really beyond compare. Thank you.
Again, maraming salamat, Health Secretary Francisco Duque. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.